to get covered by the insurance. So, but it still cannot cover all the patient, all the people, right? It only cover maybe 30 to 40. I mean, the commercial insurance only cover 30 to 40 people in China, but um, government insurance, they can cover 90% of patients. But a lot of new drugs, the new personalized drugs, they cannot get into the list of medical insurance of the government. So it still remain a very high price. So that's why patients is worrying about the price. Mhm. But now, we have a lot of fund from government, like if you use these drugs for 6 months and it is still effective, and then you can get the fund from government, and the following drugs are all free from the patient for the patient. So this is another way from government who supported those patients using personalized medicine. So this is another way. And I think a lot of personalized medicines from the 国际的药厂 international pharmacies, because they cost a lot like 30 grand Chinese yuan per month. So those drugs, they will got fund from the government. Like patients, if you use it for 3 or 6 months, you still benefit from it. So the government will cover the last of the cost from the drugs. So this is three ways I think the patient can get this problem solved.
Thank you very much. And I guess that the same problem of inequalities, I mean, in Europe, we have incredible inequalities, geographical inequalities between mostly West and East. We have socioeconomic inequalities. I guess that you are also thinking about how to reduce these inequalities. Is there any specific approach? I understand that the government is trying to bridge this gap, but what do you believe is the best possible, even further approach?
You mean for the generic
Yeah,
drugs?
in general, yes. Yeah.
In general, okay. You mean the quality, to how to control the quality of the generic drugs?
Yeah, in general, I mean access to care, so essentially what happens is that it's difficult, as you said, access to care, of course, to innovative drug even more. But in general, I guess for diagnostics and treatment would be the same. So what we are doing in Europe at the moment is to encourage member states to have comprehensive cancer center, where you can concentrate and focus the excellence of care on a reasonable geographical distribution, because just to give you an idea, there are still member states in Europe that do not have a single comprehensive cancer center. So you may imagine that in this country,